birthday to you. Hey! My grandma's everything to me, everything. 99, Gran. She's the most important person in the world, you know. She looked after all of us when we were younger, and now it's our time to look after her.
Dolly Anderson has lived for almost 100 years, but her family have no idea where she'll spend her final ones. Her advanced dementia means little remains familiar. Now her granddaughter knows she may even lose her home.
It's life and death, basically, whether she stays in that home. I'm assuming the staff are just going to pack up her belongings and send her off in a vehicle with somebody she doesn't know to a place where she doesn't know, and then she'll be met by new staff and taken away for at least 2 weeks period of isolation. She's just going to be abandoned, basically. She's going to feel abandoned.
Brushwood is one of 2 homes in Liverpool currently facing closure. The pandemic has cleared so many beds that the 83 remaining residents may have to look for new ones.
We actually lost my granddad, me nan's husband, to COVID in April. They want to take her home away from it. It's devastating.
It really might be his last birthday if we have to move him again, because it's Brushwood who's brought him on.
There are similar stories across 61 councils in England, Scotland and Wales, with data obtained by ITV News showing that in August, empty beds had increased by 88% on average compared with last year. In Caerphilly, the rise was 153%. In Dundee, it was 318%. In Derbyshire, 169%, while in Liverpool, it shot up 395%.
There's no promise of additional financial support from the government at the moment, and without that we can't help the care homes, and without that help the truth is that not all are going to continue to be viable and come out the other end of this COVID epidemic.
Homes will have to close.
I would be surprised if we don't see homes closing across the country, yes.
As you can see, this is one of our standard rooms which has been empty for several weeks now.
Carers say the problem isn't just the beds vacated, but the fact that nobody wants to fill them.
The families are reluctant to place their loved ones in nursing homes because they saw the pandemic and they saw it tear the heart and soul of the care sector. And I think families are making a decision that they will manage a home for as long as they can.
So, having fought to get COVID-19 out of their homes, tonight it threatens to close them.